Thank you all for joining us for an update on where we are in the pandemic here in Colorado. 29,299 cases. We have lost 1,373 Coloradans to this deadly virus, 615 whom it might have been a contributing factor. There's still good news in Colorado, and you know, sometimes when things are going well, you're more worried than when they're going poorly and you're trying to reverse them, because this progress is only as good as the will of the people of Colorado to wear masks when they're in public and stay 6 feet apart when they can, especially as everything is reopened and people are back. They've been back at restaurants for a number of weeks now and stores, but now bars, and if you choose to go gambling in a casino. It's still going the right way. In terms of new cases, 12 of the last 14 days have a downward trend. But you know, we're seeing a lot of cause for concern in neighboring states, and the virus is the same here in Arizona, in Utah, in other states. We're actually the only state in the Pacific or Mountain time zone that's seen a steady decline in cases. And the virus is the same here. So we worry that Colorado will join the trend of the other states to our west that don't have a steady decline in case count. And we're worried that reversal in a trend would lead to additional loss of life here in our state. So this is crunch time, folks. We need to make sure that for the next few weeks and months, we wear our masks in public when we're out with others, especially with all the new freedoms we enjoy, with all the businesses that are open, and of course, really make it a major effort to have social distancing where possible, staying 6 feet apart, and just hanging out in smaller groups and trying to see less people. One thing's for sure, if we go back to living the way we did in January and December, when we took life for granted, the virus will have exponential growth. We know that in that social environment that we had in January and February, the virus grew exponentially in our state. Now, the good news is I don't think Coloradans are going back to that, but it's a challenge for people, a matter of individual responsibility. And the areas that have been successful in containing it globally are generally areas that have adopted widespread mask wearing or already had it as part of their culture. And then these safety precautions in restaurants, in bars, in workplaces, they're so important to follow. They're so important to follow. It's not a matter of trying to figure out how an employer or a worker can get around them. It's not some game. We as a society need to learn to live with this virus and not give it an environment that allows it to grow exponentially and overwhelm our hospitals and cost thousands or tens of thousands of lives of Coloradans. That's fundamentally our challenge. There's some warning signs just in Boulder County in the last week alone, over 100 cases. These are largely graduating students and CU students that weren't following health guidelines. They had parties. They were proud of graduating, proud of the end of the school year. It was an unusual school year for them. I get that. Now more than 100 of them, I think 108 in the last week, have coronavirus. Now, if you know that community, and I do because I'm from Boulder, many of those students also have jobs. They work in retail stores. They work in restaurants. That's what they do for a living. So those precautions that people are taking at stores, at restaurants, are so critical at preventing those 108 students from spreading the virus to hundreds or thousands of Boulder residents who are customers or fellow workers in those stores and restaurants they work. That's why when you go into a store, when you go into a restaurant, the employees should be wearing masks. It's for their safety and for yours, and it's also for us to allow this progress to continue in our state. If caring about your own life isn't enough, if caring about the lives of your friends and loved ones isn't enough, if you enjoy the freedom that we have, if you care about the economic recovery of Colorado, please wear a mask whenever you can. Of course, for those who work in stores and restaurants and other public venues, and for customers, the life you save could be your own, and it also will prevent the site-based outbreaks that we have in our state, and will continue to have, from becoming community-based outbreaks. That's examples of what's going on in Boulder now. It's within a sub-community in Boulder of students who violated, public health guidance, and it risks becoming a community-wide outbreak if people aren't following the right precautions and wearing masks in stores and when they enter and exit restaurants, obviously not while you're seated. This is serious stuff. And sometimes, I use the baseball metaphor a lot because I'm a baseball guy. And by the way, I talked to Rockies owner Dick Monfort today. He's optimistic, cautiously optimistic. The players and the owners will reach an agreement. And we are excited that hopefully in mid-July we'll welcome the Rockies back for a limited spring training in Coors Field and then a limited regular season. And we certainly hope that the owners and the players come together soon around a final agreement. But it's really about our safety. It's about behavior. It's about continuing. And the baseball metaphor is, when you're down a few runs, you're doing everything you can to catch up, and you're working hard. But when you're up a run, and you're in maybe the fifth inning of this thing, and you got bases loaded, there's the other team has bases loaded. You're up one run, it's the sixth inning. That's when you're worried a little bit more. You're worried they could break through and burst this thing open. I'm worried the virus could break through here in Colorado because it has in other states recently, now, in the next week. And all that we can do to contain it is make sure that we don't provide the social environment in which it thrives. It's simply a function of behavior. It's not a function of the virus. The virus is the virus. Our behavior. Being smart, wearing masks, limiting our social interactions, trying to be 6 feet from others. That's how we're going to get it done. We need to double down on what's working. Distancing, wearing masks, washing your hands, good hygiene. And these precautions are even more important as we enjoy more activities. Residential summer camp guidance is out. Indoor events, outdoor events, bars opening soon. The small piece of personal services that wasn't back, where facials and shaving back. And in general, this is how we're going to live for some time. Some counties will be entering the Protect Our Neighbors phase, have even more freedom. They're beefing up their public health departments. I talked to county commissioners and electeds, I think it was yesterday. They're very excited about the opportunity to show that they have the ability to do the increased testing, tracking, and tracing necessary to enter the Protect Our Neighbors phase. And as we continue to open, more of the responsibility is placed on individuals to do the right thing. That was always the case. Even during the stay-at-home period, nobody was going to arrest you or lock you up if you didn't stay at home. It was about personal responsibility and doing the right thing. This is still about personal responsibility and doing the right thing. You don't have to stay at home all day. Some Coloradans are. My parents, 76 years old, they're staying at home. And I support that decision because I really want them here to see their grandkids grow up and graduate high school and college, and folks in their 70s and 80s are at a much higher risk. Others are cutting down on their activities, seeing less people, and others are deciding to take on a acceptable level of risk and going out and being smart about wearing masks and trying to stay 6 feet apart from others where they can. So please, exercise personal responsibility. You can certainly take informed, educated risks if you choose. Others want to stay safer at home and in the great outdoors, away from others. And there's a lot of medium risk activities that more and more Coloradans want to do, whether it's playing on playgrounds or shopping indoors, on visiting a swimming pool. And, again, just be smart, be aware, and try to stay 6 feet from others. And when you're around others in public, it's important to wear a mask. Update on telehealth. We're all adapting to this new reality, and the more that we can deliver high-quality medical services remotely, the less people have to interact with others. And frankly, the more convenient and lower cost it is as well. I want to praise our Office of eHealth Innovation for really helping to make Colorado a leader in telehealth. And today I'm proud to announce a new centralized website, healthathome.colorado.gov. It's a one-stop shop for information about telehealth. It's available in English, y Español, and it's really it encourages visitors to have virtual visits with your provider. Shows how your insurance can work for that, find free resources around accessing virtual care. There's also a toolkit that can be used by community partners to increase awareness about community care. healthathome.colorado.gov. Really important for Coloradans across our state. And the more people use telehealth, the more personal interactions we can avoid, and the more that we can do to suppress COVID-19. I want to take a moment to also praise everybody who has been involved with the effort to contain outbreaks at long-term care facilities. Colorado National Guard, CDPHE, Colorado State University, so many other partners protecting our seniors in our nursing homes. We know that these facilities are particularly vulnerable to two reasons. One, they're vulnerable because in any residential setting where people share resources, the virus can spread like wildfire. Second, you have a very high at-risk population, folks in their 60s, 70s, and 80s. And I'm glad to report that the Columbine Health System, which has the first long-term care facility to experience an outbreak in Colorado, the very first, now has 0 positive tests and 0 residents with symptoms. Congratulations, Columbine Healthcare Systems. I know it's hard. It's hard on residents. It's hard on their loved ones, reduced visitation, limited visitation. But they have avoided unnecessary loss of life, and we want our loved ones to be with us for years or decades to come. None of this means we're out of the woods. Quite the opposite. Means that the extraordinary steps that we're taking to protect older Coloradans are working. Now, we're working on implementing the Lifeline Pass to provide more visitation, and obviously we care deeply about making sure that people can socialize in a safe environment. But we need to make sure that we continue what's working, because the virus is the virus, and on its own, it will rip through our senior centers and nursing homes, as it has in the past year, as it has in other states and other nations. And that would lead to great unnecessary loss of life, and it would quickly fill our hospital capacity, because as much as 1 in 3 or 1 in 4 seniors who contract COVID need hospitalization. It's been 3.5 months since our first confirmed case of coronavirus in Colorado. Might feel like a year, might feel like an eternity, but it's been 3.5 months. And that's our first confirmed case. We strongly believe that it was present in our community for a month or two before that. But when we began this crisis, we had 3-4 news conferences per week with critical updates on how people could stay safe. We went to 2 press conferences a week. Going forward, we're going to have 1 coronavirus press availability per week, unless we need additional ones as needed. So as long as Coloradans are wearing their mask and staying 6 feet from others, we're going to have 1. The minute that starts going the wrong way, we might have to have more effort to keep people safe. But look, we know what we need to do. You know what you need to do. Let's do it, right? We know it's about wearing masks in public, and you can make one out of a T-shirt. This is a disposable one. You can use a scarf. Any facial covering covers your nose and your mouth, and prevents those particles from being spread. Works. It works. And it's even more important than we thought when this 3.5 months ago. Recent evidence shows that masks are even more effective than we thought in reducing the spread just in the last couple of weeks. And of course, staying 6 feet from others, limiting group get-togethers, not having the same kind of wild parties that led to over 100 college kids at CU and their friends get contracting coronavirus. I'm going to continue to be accessible. We're going to do online. We're going to do bill signings. There's a number of bills. We'll be doing those around the state. We'll be doing some immediate availabilities, but we'll be kind of focusing our communications generally about once a week on coronavirus, if more as needed. And before we get to questions, I want to address one more topic. This morning, the Supreme Court delivered a landmark decision that allows hundreds of thousands of dreamers across the nation to continue to work legally, to live legally without the fear of deportation. These are aspiring Americans who know no other country besides America. Many have been here since they were 2 or 5 or 6 years old. They grew up here. They were cheerleaders and football players. They went to college, some of them, and they work alongside us. They're our friends, our neighbors, and thankfully, the specter of deportation has been lifted for the time being. And I know it's difficult for dreamers in Colorado across our country, and I'm thrilled that our dreamers will no longer be forced to live in fear. And while I'm glad the court made the right decision, I renew my call on the United States Congress to finally create a pathway to citizenship, a way that people aren't in limbo for years or decades and can normalize their status over time and someday take their place alongside our fellow Americans with the full rights and responsibilities that that entails. I have a couple of questions I was going to go to online before we get to our media questions. I always try to take questions online. And there's two different ones that have two perspectives. There's many perspectives and many issues. So here's one. This is Paul. He says, thank you for being a kind and benevolent overlord of my safety. Thank you for shaming me so I will remember to wear my mask. He's being, of course, facetious. Long live Governor Overlord Polis. You are full of wisdom and knowledge. Will you please come to my house and watch me eat my food and tell me if I'm doing it correctly? I might need some instructions on how to put clothes on, too. I want to control people. I want to be just like you someday. Thank you for your mighty benevolence. And then another person, Amy, said, sadly, you should have issued a mandatory mask requirement. You should do it now. I think what's important here is that Coloradans don't view this as anybody's effort to control what you do. In some areas of our state, there are mask requirements when you go into stores or public places, some cities in our state. Across our state, the workers in stores, for their own safety and the safety of their customers, are wearing masks. But this is a choice, and I encourage you to make the informed choice and the right choice. Some people don't find them comfortable. Some initially say, that they can't. It takes a little while to get used to it. But it's going to be with us for a while. And the more, it's not about anybody trying to control you. I never wore a mask before this whole thing, and now I wear a mask. I mean, I have no stake in trying to control Coloradans to wear a mask. Other than that, I care deeply about our economic recovery, our opening, and I care about saving lives. And because I care about those things, yes, I want to give you the very best information so that you come to the same conclusion that I have and that scientists have and that doctors have, and that wearing masks in public is the best decision that you can make for your safety, your loved one's safety, for the sake of our economy and our way of life and the freedoms that we enjoy. Please wear a mask. And again, there's some Coloradans that wish it was in order everywhere. There's some Coloradans that don't like anybody even telling them that it's a good idea. I encourage you not to do it because somebody's telling you to do it. Do it because you care about your life and your loved ones and our economy, and you can certainly do the research yourself and see the impact that they have. Another final one before we get to questions. In Arizona, they're now having to close small businesses a second time because positive cases are exploding. Now cities are making masks mandatory in Arizona. They did not follow opening guidelines. Just something to think about from Laura. Very true. Look, we have to show that we can live with this virus and that it won't overwhelm our healthcare system. I care deeply about our businesses. I care deeply about our economy. I care deeply that we're in a situation that kids can go back to school in the fall because we don't want our future to be a victim to this virus, and our future relies on education and opportunity, and I've spent a lot of my life founding and running schools, serving on the Education Committee in Congress, and donating a lot of my money through my foundation to schools. I care deeply about schools, and our ability to open schools, our ability to keep our economy going, really relies on people making the right choices. So far you have. As I said, we're one run up. We're still in the 5th or 6th inning here. We're one run up, but yes, the bases are loaded. We have runners on base in Utah and Arizona, and it really depends on our behavior here in the next few weeks and months, and I am confident that we can do it. With that, we'll open it for questions.
You mentioned the outbreaks in Boulder. Have we seen anything similar in Denver connected to protests, and if not, why do you think that hasn't happened?
So we don't yet have full information on exactly, the level of infection that occurred at the protests. I think it's very likely that some people contracted coronavirus in protests. And remember, these protests were not limited to Denver. They were in a number of cities across our state. In fact, several of the people that have been confirmed positive in the Boulder outbreak have attended protests themselves. So what we don't yet know is people that did not contract it from any other source but were at the protests, in fact, got it from the protests. I hope I hope that it's a small number of people that were infected at the protests, but we'll have better information on that in the next week.
Hi, Governor. This is Mary Ann Goodland from Colorado Politics. I have two questions. Your executive order on the disaster emergency expires on Monday. Do you intend to extend it? And secondly, we have a revenue forecast coming out tomorrow. What financial tools do you have in case there needs to be more to deal with the budget crisis?
So the state of emergency and every executive order we evaluate and we modify as we move forward. Most recently, we've updated our public health guidelines, completed the Safer at Home and in the Vast Great Outdoors to make sure that bars and other businesses that weren't given specific guidance have the guidance they need to reopen in as safe a way as possible. There's no question that this is and remains a public health emergency that we all need to take extremely seriously. The federal government, CDC, and all of our state epidemiologists and scientists agree that now is the time to double down on what works in our state. Wearing masks, staying 6 feet apart from others to prevent the situation from deteriorating here in our state. We used some budget tools last year, Mary Ann, as you know. We were able to, before the end of last fiscal year, in these few months, reduce expenditures. We will be eagerly anticipating the forecast data, but it's unlikely any decisions will be made based on the forecast data. Decisions will likely be made based on subsequent real data as we enter the fiscal year, and certainly we are prepared for all eventualities, including a faster recovery, a recovery that looks similar to the models that are being presented Friday or have been presented in the past, or in the worst case, a more severe recession that necessitates additional cuts to balance the budget.
Governor, you talked about being kind of on the precipice here, and to throw back your baseball analogy, it seems like we're throwing a pitch down the middle of the plate by reopening more things and talking about this next phase. Have you thought about hitting pause in some of these reopening steps, given the fact that the surrounding states are having a rise in cases and other parts of the nation are seeing similar issues?
Well, look, let's continue this this baseball metaphor. So yeah, look, you got 3 balls on the batter and the bases are loaded. So, you know, that next pitch, you don't want to paint the corner with it. Unemployment's 13%. You know, consumer confidence is shot. People are spending through their savings. Unemployment runs out in July. You know, you got to throw a strike. You got to throw a strike. Let's hope we got some heat on it. Let's hope that we can maybe put it a little bit inside, a little bit outside, a little bit low. But yeah, you can't try to dust the corners and be fancy with 3 balls. Or the situation will deteriorate. We stand ready, and particularly county health organizations stand ready to take additional steps in counties that where those steps are needed. So the goal in this phase is, first of all, understanding that different parts of the state are going to be in different situations at any given time. We created the pathway to protect our neighbors, kind of the complete openness, you know, avoiding very large get-togethers, but how we will live with this. But it's also expected that, for instance, if Boulder were to fail to contain the virus at the student level, if in fact those folks were working at restaurants and stores and people weren't doing mask wearing and it spread to hundreds and hundreds of community members, that community would likely need to take additional steps before it expanded to additional communities. So we are in regular contact with every county health department. That's why through the Protect Our Neighbors phase, there is a real focus on improving capacity in county health departments for tracking and tracing, for early diagnosis, for testing. Many of them have it. Some of them need to develop it further. And we will need to have tailored, focused reactions to outbreaks to prevent them from becoming community-wide. But Coloradans deserve the opportunity to enjoy our freedoms, to have our economic recovery, and we have to show that we can execute those responsibilities. We can execute those choices with responsibility. Telephone?
Hello, Governor. Jesús Carraquet from Noticias Univisión. Gobernador, ¿cuál es su opinión sobre la decisión de la Corte Suprema sobre el programa DACA y cuál sería su apoyo a estos soñadores?
Hoy es una gran victoria para todos los residentes de Colorado y Estados Unidos porque los soñadores añaden demasiado a la fuerte y prosperidad de nuestro país. Aquí en Colorado sabemos que nuestros inmigrantes hacen de nuestro estado y de nuestro país un lugar más fuerte y mejor para vivir. Los inmigrantes enriquecen nuestras comunidades. Estoy encantado de que los miles de Dreamers en Colorado ya no se vean obligados a vivir con miedo cada día. Y alegra que la Corte haya tomado la decisión correcta, aunque todavía necesitamos que el Congreso Nacional actúe y cree un camino hacia la ciudadanía. Este es un momento histórico para nuestro país. Ahora, en este momento, para que el gobierno federal trabaje en conjunto en una reforma migratoria integral bipartidista. Hoy es un día fantástico para todo nuestro país, porque los soñadores y todos nuestros inmigrantes añaden mucho de las ganas de nuestro país. Gracias. Is there a phone?
Yeah, hi, Governor. This is Allie Levine from 9 News. Thank you for your time. Quick question regarding casinos. So recently, they were allowed to open with slot machines being able to be used, but some bars and other areas in Colorado aren't able to use arcade games. Kind of similar premise there. Any reason for that differentiation?
Yeah, I would expect that the forthcoming guidance would be similar in the sense that there are spacing guidelines around how gambling devices are used and cleaning protocols for those. Those might be more customary in a regulated casino environment, and there might be additional steps that video game arcades would undertake around cleaning and moving large, heavy video games so that they can meet the spacing requirements. But certainly that work remains to be done, and we want to make sure that there's guidance in place so that people can enjoy their lives in a safe way as reasonably possible, and that's the key. If you're at risk or particularly worried about contracting the virus, you probably don't want to go to a casino or to an arcade or to a bar. If you do go, be cautious. You can stay with your small group, avoid interacting with other groups, wear a mask if possible, stay 6 feet from others where possible, and understand that there is some risk of contracting the virus in those kinds of public environments. Oh, in person, yeah, go ahead.
Said that you're not going to take any more action on evictions, but all these groups are warning that there's hundreds of thousands of Coloradans who are at risk of losing their homes coming up. So I'm wondering if there are any behind-the-scenes discussions that you guys are talking about outside of this 30-day pause. One state lawmaker talked about the nonprofit sector maybe stepping in to help, but certainly it doesn't seem like they have enough money. So what are you expecting to happen here, and are there any discussions that we don't know about?
Sure. Well, we have taken additional action, and in fact created a timeline where unless there is a public safety issue, folks are not going to be evicted for, it looks like, at least 30 to 60 days, which is longer than we initially indicated. We thought that evictions would likely resume in early June, so at this point it looks like July or even August for some. Also, very importantly, the legislature passed financial assistance for renters. And so Department of Local Affairs, DOLA, is going to work on making sure that, and we've already announced previous programs in that area, that the money actually reaches those to be able to make sure that they don't just, that their eviction isn't just delayed 30 or 60 days, but they can catch up, make whole. There's a cure opportunity in our executive order. And as the economy gets going, we're hopeful that many people who've been out of work will be able to, either through unemployment or through finding a job, be able to take advantage of that cure period. Yes?
RTD is facing some serious financial challenges. You've talked about greater accountability, but with the sheer changing their revenue. They're looking at pretty sustained service cuts, and of course, your train to Boulder will be even longer coming. Do they need a financial bailout, and what, if anything, could the state or the feds do there?
Well, it's premature to say what they need, other than they need significant change. That's why we're creating this process with Senator Winter, Representative Gray, the respective transportation chairs of the transportation committees in the legislature. If I don't pretend to have all the solutions. I think I know the problem. I think most Coloradans know the problem. They know it's not working. We know we need to change things. We're going to put together the right team of people to bring forward those changes as soon as possible. Telephone?
Governor Polis, we have watched other cities like Atlanta recently release police body camera video of officer-involved shootings within hours of the incident. Yet here in Denver, it's been weeks since the OIS involving William DuBose without the release of any of that footage. What makes Denver, or Colorado for that matter, any different?
Well, look, this is another reminder of the importance of community trust in the process and building those bridges of trust between communities and law enforcement. And that's why Senate Bill 2217 is so important, which I'll be signing shortly. Coloradans should really be proud of the way that our Republicans and Democrats in our state legislature came together to lead the way, to make policing more accountable and help heal the divide between those who do the policing and those who are policed by restoring trust in law enforcement, upholding individuals' civil liberties, and laying the groundwork for future discussions about criminal justice reform. I'm really honored to be here at this moment in time alongside so many passionate Coloradans on the journey towards a more equal and more just and more peaceful society.
Hi, Governor Polis. It's Ed Seelover with the Denver Business Journal. I know you released draft guidance for indoor and outdoor events on Monday. Two questions. One, are you planning on releasing final guidance on that today or tomorrow? And two, how do you respond to concerns from hotels who say that the 100-person limit on those events in places like 60,000 square foot ballrooms is just too small and won't allow them to be sustainable?
Yeah, so those, the public comment period for the indoor and outdoor guidelines ended yesterday, and they will be finalized this evening or tomorrow morning and made publicly available. And I'm hopeful that some of those concerns that you have raised will be addressed relative to the size of the venues. We also want to bring focus to the effort to help more counties get to the Protect Our Neighbors phase, where they can have events up to 500 initially. And over time, we hope to even expand that when they've demonstrated success after a matter of weeks. That 500 number can increase. So that's really a matter of making sure that counties can have the public health capacity to do the testing, the monitoring, the tracking and tracing to prevent outbreaks at a site or a conference or a meeting from becoming community-wide outbreaks. Thank you.